Ladies and gentlemen, dear colleagues, good morning, good afternoon, good evening, and perhaps good night, depending on where you are in the world right now. Most welcome to Shaping the Future of Self-Care Through Pharmacy. Next slide, please. And the next one. My name is Lars-Åke Söderlund, and I'm the president of the Community Pharmacy section and also the co-chair of the FIP Congress Program Committee. It is my great honor and my great pleasure to share this first event in a program of 17 events. As healthcare providers, pharmacists have an important role to play in supporting self-care. FIP is therefore launching a new 17-event digital program, Shaping the Future of Self-Care Through Pharmacy. And this program is composed of 8 episodes that will focus on accelerating universal health coverage for all by enabling self-care through community pharmacy. And additionally, 9 episodes will focus on self-care support for community pharmacy teams. Today's event will set the scene for FIP's self-care digital events program. It will describe what the program consists of and the main learning outcomes. And this topic is so important because pharmacy teams are increasingly supporting patients with self-care. And this has been very important also during the coronavirus pandemic. And of course, this event will also describe what self-care involves, its benefits, and the future of self-care. And there will also be a panel discussion about how pharmacy can shape the future of self-care. Next slide, please. Before we continue, let's look at some housekeeping rules. This webinar is being recorded and live streamed via YouTube. And the recording will be available at our website, www.events.fip.org. And you may also ask questions using the question box provided. You're welcome to provide feedback and suggestions for our future events also at webinars at fip.org. And I would also invite you to become a member of FIP. You will find all the details at our webpage, www.fip.org. And this will probably be the best investment you can ever make. Next slide, please. So during the session, if you have any questions, please use the Q&A toolbox at the bottom of your screen. And this makes it possible for us to keep track of all the questions. So please don't use the chat box because it's possible that the questions might disappear in the chat between different participants. We will also answer all the questions at the end of the session when we have the panel discussion with all the speakers. Next slide, please. Before we start the event, I myself and FIP would also like to thank Reked Benkiser for sponsoring and supporting the online program regarding self-care. Thank you so very much for your kind support. Next slide, please. The WHO defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. And of course, self-care is reliant on consumers' health literacy. And self-care in terms of access to medicines, well, is usually use of medicines to manage minor ailments using non-prescription or OTC medicine. But of course, it can also be self-care for chronic conditions. The responsible self-medication needs appropriate advice by the pharmacist. And this is becoming more and more important as we also have digital channels where patients might ask for support or help when it comes to self-care. And of course, self-care interventions have a unique potential in reducing inefficiencies in healthcare expenditures, improving the quality of health coverage, and increasing the agency and autonomy of even the most vulnerable populations to make informed decisions about their health. So self-care is not meant to be disarticulated from health systems, but should serve as a complementary intervention that allow linkages to healthcare. And most of us already practice self-care that protects our health each and every day. For example, in eating healthy, doing exercise, or ensuring we get enough sleep. And sometimes these acts are not sufficient to protect us, and additional support from health professionals is needed. Currently, 3.6 billion people Half of the world's population lack access to essential health services. And the WHO recommends self-care interventions for every country and economic setting as a critical path to reach universal health coverage, promote health, keep the world safe, and serve the vulnerable people. Next slide, please. A WHO conceptual framework has therefore been developed to support policymakers and implementers who are thinking through the complexity of promoting high-quality self-care interventions. The framework aims to ensure that all individuals are considered, including those who may not be aware of their right to health and those who may fall through the cracks of the existing healthcare system. So why do FIP launch a program about self-care? Well, the aim of today's event is to describe the future of self-care, its healthcare needs and challenges, as well as the role pharmacy can play and is playing. The conceptual framework recognizes that in addition to the traditional self-care practices that societies have passed on through generations, people are accessing new information, new products, and interventions through stores, pharmacies, and the internet. And digital health and mobile technologies are increasing rapidly, not only as places of access, but in many other aspects of self-care as well. Accountability for health outcomes is reflected at multiple levels in the conceptual framework, and accountability of the health sector remains a key factor in the equitable support to quality self-care interventions, and meaningful community engagement where self-care is championed and advocated by patient groups is also an essential factor in the success of the linkage to care. Next slide, please. Self-care is also a very important tool to reach the 3 billion target or goal identified by the WHO. 1 billion more people benefiting from universal health coverage. 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. Next slide, please. Let us now jump into the program and today's event. The main outcomes of the self-care program today is to define self-care, list the benefits of self-care, and consider the healthcare needs and challenges of self-care. And of course, healthcare has many needs and is facing many challenges, but there are so many opportunities to handle this as well. And to discuss the role of pharmacy in shaping the future of self-care. Next slide, please. Looking into today's event, this is our program. These are our topics: defining self-care and its benefits, healthcare needs and challenges, the Self-Care Readiness Index, the future of self-care, and opportunities for pharmacy to support healthcare, self-care, and the FIP Community Pharmacy Section's vision. Next slide, please. We have 3 experts on self-care with us today: Ms. Mary Stenmark and Ms. Catherine Laverty from the Global Self-Care Federation, and Mr. Derek Connolly, Vice President of the Community Pharmacy Section, FIP. Most welcome, all of you. Next slide, please. This leads me to introduce the first speaker, Ms. Judy Stenmark. Judy has been leading the Global Self-Care Federation since September 2020. And during that time, she has overseen a restructure and rebranding of the organization and implemented a new direction, the future of self-care strategy. Judy Stenmark has a background in health with a degree in physiotherapy and a master's degree in public health. A long-standing career leading global and national NGOs in the musculoskeletal arena, with an 8-year tenure as head of the International Osteoporosis Foundation in Nyon, Switzerland, and 9 years leading Osteoporosis Australia before that. As an Australian national, Judy has spent the last 10 years living and working in Switzerland. In this time, she has established a strong network with global healthcare institutions, including the World Health Organization, international scientific academia, and among many global pharmaceutical and consumer health companies. Please, Ms. Judy Stenmark, give your presentation about defining self-care and its benefits.
Thank you, Lars. Hello, everyone. It's really my pleasure to be here today, particularly with our valued partner, FIP. So it's a really exciting program you have lined up. And of course, it's all about self-care. So we're really delighted. So first of all, I'm just going to talk about a little bit about self-care and the benefits that we know about and some of the things that we need more information about. So next slide, please. So just to tell you quickly who we are, we were formerly the World Self-Medication Industry, but we're the Global Self-Care Federation, and we are a trade organization, and we represent manufacturers in the self-care industry and also associations. So we're committed to promoting better health outcomes for all. And what we really want to see is self-care embedded in health systems for better sustainability. As a source of self-care information for all healthcare professionals, we work closely with our members and key stakeholder groups. And our mantra really is to deliver better choice, better care, and better value for all. Next slide, thanks. So Lars talked about the WHO definition of self-care, which we think is a good one. But what else does it refer to? It's about holistic choices, holistic practices and activities. So that might include products like medicinal products, OTCs, over-the-counter medications, devices, nutritive products that someone can adopt to improve their health and well-being. And as Lars said, with or without a healthcare professional involved. So it's about making better lifestyle choices, avoiding unhealthy lifestyle habits, making responsible use of prescription and non-prescription medicines in particular, being able to recognize symptoms, about self-monitoring, and also self-management. And one of our key goals really is to see more individuals around the globe become active self-managers of their health, of their own health. Next slide. So, in terms of the value of self-care, we need more information. We have some information on what we think is the value of self-care. And it's not just the cost savings, although they are significant, but it's also the individual, the value to the individual, the social value, and of course, the better health outcomes for the individual that are equally as important. But self-care can ease the burden on overstretched health systems by reducing costs. And we know that. And for example, in one major study, moving just 5% of prescribed medications, so switching medications to non-prescription status across Europe, for example, could result in an estimated total annual savings of more than 16 billion. And we know that our European member AESGP is about to launch a new European study focused obviously just on Europe, on the economic and social value of self-care. And that will be really interesting to see the other items that come out of that. And for example, in the US, we know $1 spent on OTC medicines equally saves the US healthcare system more than $7 per intervention. And in Latin America, $3 billion is used in the treatment of non-serious conditions by public health systems now, and that is a huge potential cost saving. Next slide, thanks. So when we look at the benefits of self-care for individuals, for families, and for communities, when we think about individuals, what can it offer? It can offer greater choice of healthcare options and more accessible entries, and of course, through pharmacies. And I'll talk a bit more about that later, but really, we've seen during COVID that, of course, pharmacy and pharmacists have really come into their own. And I think people have really started to realize the great value that pharmacists bring as a trusted source of information and advice. So I think that's been a plus out of COVID, but I think we really need to build on that and make sure that that stays for people. But also it offers greater value for care in many cases when people can take their own health into their own hands for treating mild ailments and some chronic conditions. And of course, we have some evidence, of course, that it can lead to better health outcomes when individuals do take it into their own hands. So for healthcare systems, of course, we've all seen in our various countries what's happened with COVID. And we can see that self-care can ease the burden on healthcare systems. And we have some good examples of that, but also freedom for innovation as well. And I think that's really important that also continues. And as Lars has mentioned, it's critically important in achieving universal health coverage. And as we know, that is one of the major priorities of WHO right now, achieving universal health coverage. Next slide, please. So self-care interventions with OTCs. Again, COVID has shone a spotlight, not just on pharmacists, but on self-care. And we are pleased to say, and used in combination with other self-care practices, people can efficiently help to protect themselves and others during these crazy times, if you like. Next slide, please. So we see the pharmacist and pharmacies as really the pivotal healthcare professional, if you like, in the self-care continuum. And nurses, of course, are critically important, but we see them as the primary providers in the patient care once people start their journey, if you like. But the pharmacists typically are a person's first point of contact within the healthcare system. And we've seen lots of innovation during COVID, but drive-through services, telemedicine, giving advice, hotlines, medication deliveries with advice. So all things that have been accelerated during COVID. But I can't stress enough that pharmacists really are a great trusted source of medical and health advice, and I think have been drastically underutilized up until now, perhaps. So again, we want to keep that momentum going. Next slide, please. So now is the time for self-care. And as I said, COVID has really shone a spotlight, and we've seen that. We've got lots of examples of that. But pharmacists have a more prominent role. But I just wanted to touch on, there have been quite a few regulatory flexibilities that have occurred in terms of OTCs and prescription medicines. And things like continuity of supply has been a critical issue during COVID, and demand for self-care products has increased dramatically with things like non-steroidal anti-inflammatories and paracetamol. So what we are looking at right now is how can we make sure that some of those regulatory flexibilities that have occurred, good flexibilities, good regulatory changes, we want to see them stay in place so that we can ensure continuity of supply, but also continued access to things to products and services that have started up. Next slide, please. So I just wanted to touch on this as the private sector as a force for good, because we've seen a lot of fabulous examples of the private sector joining together during the pandemic to not only provide millions in life-saving resources, but also direct finance. And now, as you see with COVAX and the initiative with WHO about getting the vaccine out there. So I think that's a really important point, and we should highlight that from some of our members. I just wanted to let everyone know that we have begun a global study on the economic and social value of self-care. We've just started this, and that will be the first of its kind, really, to really drill down into the value and the economic and social value, and especially in the many regions of the world. So we have pretty good data in Europe, as well in the US, England, UK, Australia, I guess the usual suspects. But what we need to really look at, and we're also doing this with our self-care readiness index, which the next speaker will talk about, but we really need to look at not only self-care practices in regions like Africa and Latin America and Asia, but what is the value? What is the cost? What are the cost savings? And then what's the social value? And of course, Lars alluded to this, but self-care is different in different regions, and in many countries in Africa, self-care is not the same, or OTCs not available, or different devices, for example. So we need to put that all together in a global study to really look at what is the true value in a global sense. And we'll be working again with WHO to put out some of those findings, because we really need to get a handle on what is the value of self-care so that we can really try and see it embedded in policy and in health systems. So I think that's my last slide for this part, Lars.
Thank you, Judy, for an excellent introduction and presentation about defining self-care and its benefits. To our viewers and participants, please submit your questions to Judy in the Q&A box at the bottom of your screen. This leads me now to the second speaker, Ms. Catherine Laverty. Our second speaker is Director of Communications and Policy at the Global Self-Care Federation. And as Judy mentioned, a federation of associations and manufacturers of non-prescription medicines representing responsible self-care. Catherine has been leading the Federation's communications, policy, and advocacy efforts since 2019. As an experienced communications expert, she has extensive history working in the healthcare space internationally in both corporate and not-for-profit sectors, having previously worked for Alcon, Medtronic, the International Osteoporosis Foundation, and in PR consulting at Weber Shandwick. As a British national, Catherine holds an MBA and bachelor's degree from the University of Manchester and has been living in Switzerland for the past 15 years. Catherine, most welcome to give us your presentation about healthcare needs and challenges, the Self-Care Readiness Index.
Thank you, Lars, and thank you to the team at FIP and to Reckitt for sponsoring this event. I'm very pleased to talk to you today about a key initiative for our federation, which is the Self-Care Readiness Index. So if you could go to the next slide, please. Thank you. So really, what is the Self-Care Readiness Index? So through the WHO collaboration plan, the Self-Care Readiness Index is a key component of that. So really, we're looking at the different elements necessary for self-care to achieve its potential in given health systems. So really looking to identify best practices and areas of opportunities for the different countries that have been involved in this analysis to reap the value of self-care in terms of healthcare outcomes and also the economic impact. So essentially, it's not a ranking of countries that are involved in the index, but it's really an advocacy tool that provides a snapshot and an overview of countries at a given point in time. So if you could go to the next slide, please. So looking at the geographical scope, to start with, we've included 10 countries represented from each of the 6 WHO regions. And we thought it was key to really have a spread of countries to reflect the diversity of global health systems and approaches to make it an interesting point of comparison. And really, we see this, we've called this the phase 1 of our index. And the idea is that once this index has been launched, which will be later on this year, we'll also extend that into subsequent editions. So in a phase 2 and a phase 3, where we're looking at other countries that can be included as part of this analysis. So that we're really building on the data and information available. Next slide, please. So through the index, what we've done is we've assessed the different countries in the previous slide against a set of 4 different enablers. So measuring how ready we see each of those countries and markets from a self-care perspective against each of these 4 enablers. So firstly, we've looked at stakeholder support and adoption. So looking at levels of support and adoption for self-care products and practices with patients, consumers, healthcare providers, regulators, and policymakers. The second enabler is concerned with consumer and patient empowerment. So looking at the drivers necessary to make sure that consumers are empowered and informed. So here it's looking at health literacy, access to information, really with a strong focus on prevention. The third enabler addressed within the index is on self-care health policy. So looking at policymakers' perceptions and decisions relating to self-care, and including a recognition in terms of the economic value of self-care products and science-based policy decisions. The fourth enabler that the index tackles is the regulatory environment within each of these different countries. So looking at key aspects of regulation, the ability of companies to price, to advertise, to distribute products. So if we could go to the next slide, please. So just giving you a flavour in terms of the methodology that we've employed. So each of the different enablers is supported by 3 to 6 measurable indicators or proof points. And within these different indicators, there's also some sub-indicators to really make it more concrete and tangible. And the research is done in 3 different ways, really. So extensive desk research, expert interviews, and then a series of online surveys targeted to healthcare providers and consumers. And then each of the countries, based on all of this information being compiled together, is then coded on a 4-point scale, so that each different country is given a different number in each of the enablers. But as I said up front, the point isn't to give, to not focus on the number that's been given, but really to look at the dialogue and the narrative that's coming out of those and the opportunities that it opens up for each of these different countries. So if we could go to the next slide, please. So in terms of weighting the evidence, we've outlined how the research has been done, but really to show that what's been, in allocating the scores, what's been favoured mainly is really the desk research, which denotes 50% of the overall scores, combined with 30% on the qualitative interviews, and then 20% in the quantitative surveys that we've issued as well, that give us these different scorings. So if we could go to the next slide, please. So obviously this hasn't been done in isolation. A key part of our WHO collaboration plan, they've been very central to developing the content and the approach with us. And we also formed an expert advisory committee, so external experts in different fields, healthcare professionals, NGOs, really having a spread of global experts to provide input to the content in terms of the research that's been done, to give credibility and legitimacy in terms of what we're doing. So if we could go to the next slide. Again, just to illustrate the organizations that we've been working with on this, as you can see, various global organizations that have been involved as part of the research, giving counsel, answering, interviews, being involved in that whole process to make sure that we have this real international perspective that's been validated by external organizations as well. So if we could go to the next slide. So just looking at some of the emerging themes that have come out from the research so far. So as I mentioned, this will be launched later in the year, which will give obviously detail of each of the countries and the findings that are there. But today we wanted to share an overview of some of the key themes and recommendations that have come out so far from this research. So the first one is really about the definition of self-care. We talked, I think Lars and both Judy mentioned this WHO definition of self-care that people agree on, but really when we drill down and look at how countries understand and interpret that, we can see that there are lots of interpretations, and it really is multifaceted and multidimensional. There's no one clear definition of what we understand by self-care. Secondly, there's a vast array of information available to individuals. Sometimes we're lost in this information. There's so many sources that are available, but there's a real need to make sure that this is credible, that the individuals are referring to sources that are scientifically correct and credible. And this isn't just for the individual, this is also for healthcare professionals in some countries as well, which really exposes the need to further train some healthcare professionals to help them advise their consumers and patients in terms of the value of self-care. Thirdly, there's a general agreement in terms of the economic and social benefits of self-care, and Judy highlighted in her presentation some of those percentages in terms of what that can offer in different countries. But really, there's only a few governments that are sharply focused on capturing that value, and we really think that there's more that can be done there. So if we could go to the next slide. So building on these themes, we've brought through a series of key recommendations that can be taken, kind of the learnings, we'd say, from the index that can be applied. So firstly, the idea that these many strands of self-care from a broad perspective need to be really woven into a powerful action-oriented definition that stakeholders can really understand and action. We think that given the multifaceted nature of self-care, the fact that it's embedded in so many different areas, that there's a real potential to bring different stakeholders together, potentially launching a global compact on self-care, and obviously with a real aspiration to having a resolution on self-care. Whether or not that's something that could happen, we really think that there's a definite value in there. Thirdly, we touched on the importance of health literacy and the importance to make sure that the quantity and quality of information that's available for individuals is credible and accessible for all, that they're equipped to be able to understand and interpret that to help measure and manage their own health. This also expands to healthcare providers, the fact that we need to do more to educate and incentivize healthcare providers to be able to offer counsel to the different patients and individuals. We touched on digital health solutions as a real key vehicle for self-care, particularly during times of COVID. We think that there's a definite opportunity there that we can leverage in terms of self-care. I think we mentioned this in the first point, but the self-care community really needs to forge a broader coalition of allies to make sure that we're really bringing the case together collectively if we really want change to happen and to drive healthier populations and also lower costs. And then lastly, at a country level, we really urge governments to connect those dots to ensure a more coherent healthcare policy and regulation across a multitude of strategies, plans that really touch on self-care. So that's today, just to give you a snapshot, a high-level overview of where this index is going, some of the key recommendations and themes, and we really look forward to sharing the report with you later in the year that really provides an extensive overview of those different countries, digging into some of the key themes that I've explained here today. So I think that's the last slide in my presentation, and I look forward to any questions coming through in the chat. So thank you.
Thank you so very much, Catherine, for your excellent presentation and introducing us to the Self-Care Readiness Index and the 4 enablers of self-care. To our attendees, please submit your questions to Catherine in the Q&A box at the bottom of your screen. And it is now my honor to welcome Judy again to talk about the future of self-care. Welcome, Judy.
Thanks, Lars. You'll be sick of me by the end of this session. So I'm just going to touch on the future of self-care, and this is a little bit of a difficult question in some aspects, but I think it's a lot of food for thought, and I'm sure there are lots of people online now who have their own views on this. So next slide, please. So what is the future? I guess I would say, what's our wish for the future? And our wish for the future is that self-care becomes increasingly or just integrated into traditional health systems that can provide better choice and better value. And of course, the crucial thing, improved health outcomes for the individual. So I would say that's not happening now, but that truly is our wish for the future. Next slide, please. So, global knowledge transfer for better global health. So I think the big changes we are going to see, of course, and continue to see around digital healthcare and telemedicine as being increasingly relevant in keeping people informed and empowered, because I think we all know that life will never go back to exactly the same, perhaps, as we knew it beforehand. And there are good things about that, and there are bad things about that. But I think individual access to healthcare professionals is increasingly limited and will continue to be so. So that only, shows and highlights that we need to increase and get better recognition for pharmacists in particular, and the community pharmacists as a great source of information and counsel and advice. But the top point there about experience being transferred through health systems, and I think we can really see that as something that will continue to accelerate in the future. Next slide, please. So if we had a crystal ball looking to the future, so of course the changing landscape, and I'll go into a bit more detail in a little bit, but tech and digital healthcare, pharmacists as the core healthcare professional for self-care, individual empowerment, telemedicine, self-care literacy. What do we mean by this? I think we know, instead of health literacy, we're calling it for us self-care literacy. How can we enhance it? What should we be doing about it? And self-care is a building block of UHC, and we've touched on this already, but we really need to be demonstrating for WHO and for leaders around the world and health ministers, what is the value of self-care? And I can't stress that enough. Next slide, please. So getting back to the changing landscape, and we know there's continually and rapid evolution of technology transforming healthcare delivery almost on a daily, weekly basis. But self-administered care with guidance from remote digital consultations will continue to grow. But two important issues to consider from a WHO 2013 report. By 2035, there'll be an estimated shortage of about 12.9 million healthcare workers. And as well, when you also think about that 1 in 5 of the world's population right now live in humanitarian crisis situations. So this really gives even greater weight to the pharmacists taking a bigger role in developing healthcare, especially self-care, to improve health outcomes. Next slide, please. So when we look at individual empowerment, we've talked about people, we want people to become greater or more active self-managers of their own health. But a few examples of where this just isn't happening and why we should be doing that. In the US, primary healthcare physicians estimate that 10% of visits could have been avoided by the use of OTC medication, and perhaps a visit to the pharmacist as well. And a typical example of this would be perhaps a 75, 80-year-old person with osteoarthritis in the knees or hips could go to their pharmacist, could have a chat to their pharmacist, could get advice from their pharmacist, discuss various non-steroidal anti-inflammatory medications, for example, exercise programs, without traveling to the general practitioner, waiting there, seeing that general practitioner, getting advice, having counsel, and then traveling home. A lot of cost savings just in that person not doing that. Again, in another study, 92% of physicians agree that OTC medications are effective and appropriate for first line of treatment for many minor illnesses, and also a lot of chronic diseases, non-infectious chronic diseases. A recent study in Scotland found that more than 13% of GP visits were suitable for management in community pharmacies. And as well, in terms of individual empowerment, and Catherine touched on this about self-care literacy. How can we enhance self-care literacy? And this, in our recent review of our strategy, self-care literacy is a major initiative for us. So how can we make sure that people in all regions of the world have access to quality information? And I think that that's a really important issue that we need to keep on our agenda. And the next slide, please. So self-care and universal healthcare, we've talked a bit about these, so I don't need to go into all of it, but increasing investment in self-care and the management of chronic diseases. We really need to focus on that to remove the heavy burden placed on healthcare systems, because chronic conditions are one of the major disease group or burdens, if you like. So this can create long-term savings for healthcare systems, But of course, the critical thing, better health outcomes for the individual. So I think that's my last slide, Christopher. Yes, it is. Okay, thank you, Lars.
Thank you so very much, Judy, for introducing us to the future of self-care and the big and necessary changes such as the digital healthcare and telemedicine, the changing landscape, and the need for individual empowerment, self-care, and of course, the universal health coverage as well. To our participants, please submit your questions in the Q&A toolbox at the bottom of your screen. It is now my pleasure to introduce our last speaker and my colleague, Mr. Derek Connolly from Ireland. Derek has been involved with the Irish Pharmacy Union since 2001, having experience on regional and national committees. Derek is a native of Dungarvan County in Waterford, Ireland, and graduated from the School of Pharmacy, University of Portsmouth in 1996. Derek is a third-generation pharmacist following in his grandmother's and father's footsteps. After pre-registration at Salisbury District Hospital, he worked in Portsmouth before moving home to the family practice in 2001. Derek is a former president of Dungarvan and West Waterford Chamber of Commerce and former chairman of Indepharm Cooperative of Independent Community Pharmacists between 2010 and 2014. And Derek was elected president of the Irish Pharmacy Union, the representative body for community pharmacy in Ireland between 2016 and 2020. He is now vice president of the community pharmacy section, FIP. Derek, welcome to give us your presentation about opportunities for pharmacy to support self-care, the open door at the heart of our communities.
Lars, thank you very much for a very complimentary introduction. Colleagues, ladies and gentlemen, I'm very excited to have the opportunity to present to you today a little bit about the vision of community pharmacy from the community pharmacy section of FIP. The great thing I see is in the chat box, so many pharmacists from around the world are joining in. And with that in mind, it brings me very, very quickly on to my first slide, Christopher, which is to say that there are fantastic opportunities for pharmacists to engage in self-care, which we do already. We do that through the open door that is the front door of healthcare, which is the community pharmacy. So for those of you who haven't seen the cover of the community pharmacy section vision for 2025, it's all about pharmacists at the heart of our communities. And what I'd like to talk a little bit about today is about self-care and the fact that we do have an open door and we offer choice and we offer access. So it's hard to see on the slide, but we managed to get photographs of pharmacists and their teams in front of their front doors from the four corners of the globe. And as you will see as well, there's a very nice big heart encompassing who we are and what we do at the core of our communities. When we put together the community pharmacy section vision, we had one of the last face-to-face meetings of FIP. The community pharmacy section met in Dublin, and we made really, really good progress. And that was in February of 2020. And it was the last meeting because COVID visited us all, unfortunately. What COVID showed us as well was what we were putting together in our vision and what we knew that pharmacists do became doubly true, because what we were able to see was that we are the open door. And it was very evident that, unfortunately, other healthcare professionals couldn't give the same amount of access to the communities that they serve for their healthcare. So in a way, this is also dedicated as a vision to all the pharmacists and their teams who worked so hard during COVID and continue to work so hard during COVID. So my next slide, please, Chris. When we were putting together our vision, it has to be done in a very broad fashion, and we have to be able to talk to every pharmacist and their team in every corner of the globe. When we had a really good open discussion about what are the core competencies of what pharmacists do, and what is recognizable to every pharmacist in every corner of the globe. We settled upon what we would call essential pharmacy care, and we have 4 pillars of essential pharmacy care. So pharmacists review medicine, pharmacists prescribe medicine, pharmacists dispense medicines, and pharmacists administer medicines. And then as we move on, we have very succinctly been able to encapsulate this idea into the next slide, which then really is what we are talking about today with self-care, that pharmacists offer access to healthcare, which gives the communities we serve choice. And also by offering choice to our communities, we are then in effect giving them access. So it's a little bit like we put together our vision, bearing in mind all of those fantastic background details that we have been given about our self-care element of what we do by Judy and by Catherine. But it isn't, because we are so well aligned. It isn't something that we consulted with Judy and Catherine before we put the vision together. We were able to do it because this is what pharmacists do, and this is at the core of what we do. So again, think of your own practice, no matter where you are in the world. And I see people who have logged on from Bulgaria and from Jamaica and from Manila. Those 4 competencies are things that pharmacists are really, really good at and can do. I say can do because I know that not every pharmacist in every corner of the globe is backed by their regulators and probably by their lawmakers to be able to do this to the peak of their practice. So if we have a look there in the bottom left-hand corner, what is very, very evident is that pharmacists administer medicines has really come to the fore when we see vaccination for influenza generally, and particularly for COVID-19. So the vision is there to point a way forward to help member organizations and to help pharmacists see what peak practice looks like and how we can give most value to the communities that we serve. There is a big picture of what pharmacists do. So as I roll on to the next slide, we can see that there is, in that big picture, we've still maintained our 4 pillars. So we review, we prescribe, we dispense, and we administer. But also what we want to do is we want to keep our relevance to FIP and the idea of one FIP, that we want to bring all pharmacists and their teams with us, whether they are in the community pharmacy section or that their expertise lie in another field other than community pharmacy. So we spend a lot of time thinking about what we do. So those are the bubbles in the top left-hand corner. We spent a lot of time thinking about our heritage. And I think the most important bubble that I see that we have in our heritage is the trust that we have built up with the communities that we serve, often over generations. And that because our heritage and the trust that we have brings us over to the bottom right-hand corner, which goes to look at how we do it. We are really good at adjusting our practices into best practice. But I suppose most importantly, we always have an eye to our future. So in the top right-hand corner, we have the bubbles that have the important factors of what our future is. And as you can see, it's already been in the vision for the community pharmacy section, that self-care is a really, really important part of that. So Chris, on the next slide, I focused in on what the future of community pharmacy is. So self-care is a really, really important part of that. So if we think of the underlining of the 4 pillars of what community pharmacists do, let's just put the self-care back into those 4 pillars. We find as we talk to pharmacists around the globe that they don't particularly see themselves as prescribers. I come across this particularly when I have, in my role as a mentor to student pharmacists. They presume that prescribing is something that involves a doctor, a pen and paper, and then a patient walking through the door to us with that piece of paper to execute the command of somebody else in the healthcare continuum or the healthcare chain. So if you consider what an interaction a pharmacist has in a self-care scenario, that somebody, and let's use the example of musculoskeletal pain, as referenced by Judy in her first set of slides. If we consider that somebody walks through the door, the first thing that the pharmacist does, or a member of their team does, is that they will review the patient's background. We will ask them the necessary questions, get to know them a little bit better, and get to know what their condition is and what is best to treat it. The next part of what we do is the other part of the pillar, which is to say that we will prescribe. So again, let's take an example from Judy. We find that the most relevant medicine, or the most appropriate medicine for that particular person, would be a non-steroidal anti-inflammatory gel. So the pharmacist has now just prescribed that medicine. We then go to the next element, which is to say we dispense it, which means to say that we make sure that that is the right medicine, going to the right person at the right time, with the right instructions. So when they leave the pharmacy, that we know that they are going to use it properly for best effect. If we then look at the fourth pillar, we can then say that if that person, and let's consider that they are not as dexterous as they might be because they have issues around movement because of musculoskeletal pain or atherosclerosis, we are in a position to help them when it comes to actually getting that first dose, or if you want to think of an eye drop, or if you want to think of a cream, how much do you use? We can help in the administration of that. So it doesn't necessarily have to be hands-on as you would with the vaccination, but it helps with the administration. So very simply, what we see with self-care is that it is completely aligned with what we can do to offer self-care and to help people in that healthcare continuum, because we are the open door of healthcare, and because we are cognizant of the fact that we want to be able to remain relevant, and that as things move on, and I move to my next slide, also what we can see is, again, and it's as if we fitted all this together beforehand, Judy, Catherine and I, and we didn't, we recognize that the demographics of populations and professions are changing. So for example, when Judy highlighted the figure for how things will look in 2035, we know that the practice of family medicine or general practice is going to change because there are fewer 40-hour a week or 60-hour a week, whatever it may be, general practitioners. But also probably more importantly, that the population that we serve, the communities that we serve, they themselves are changing. They are more literate, they have more access to healthcare professionals, and that includes the ability to talk to healthcare professionals online, which is a service offered by lots and lots of pharmacists now. And it's one that's existed for a long time because people have been having telephone conversations with their pharmacists for a long time. So as that moves, the demographics of the populations move and the demographics of the professions move. It goes again to highlight how important self-care is in the practice of community pharmacy. The other item, as we see down in the bottom right-hand corner, and again to echo what my colleagues have already pointed out with lots and lots of evidence, we have proven improved outcomes for the communities and patients that we serve by being the open door, by giving them access to sometimes what are considered very simple medicines, OTC medicine, but also making sure that they're used properly to best effect. I think the most important little bubble that we have on this slide is in the bottom left-hand corner. Sometimes, not sometimes, very often, the most important people in the conversation about healthcare are the ones who get spoken to or spoken about or considered at the very last. And those are the people who need our care. I find it very frustrating, and I know that every pharmacist, every other healthcare profession finds it very, very frustrating. But often when we build a picture of what healthcare looks like, it isn't the patient who is in the center of the picture. It's the healthcare professional is in the center of the picture. I know that as pharmacists and as community of pharmacists around the world, we really, really want to move that. We want to move the patient, the person, into the middle of the picture. And then we must decide what it is that we can do to help them best. The best way to do that is to actually ask people what they would like their pharmacists to do. And in every corner of the globe, when patients are asked what they would like their pharmacists to do, they would like their pharmacists to be able to do more for them. And the 4 things that they would like them to be able to do more of is they would like them to be able to review their medicines more. They would like them to be able to prescribe more. They would like them to be able to dispense more medicines, and that can be at over-the-counter level, but it also can be for moving care and medicines from secondary care into primary care, which is community pharmacy. And absolutely the hottest topic that we have at the minute is people want to be able to access their COVID vaccinations through community pharmacy, because as we know, we are the most trusted and we are the most accessible. So if we now move up to the top left-hand corner, we can see that all of this exists in a community pharmacy arena in which the skill set of community pharmacists is underutilized, and every single review of community pharmacy has always come up with that same answer. Self-care is a fantastic stepping stone for us to be able to showcase and highlight the good that we already do. But I think it also gives us the opportunity to say that there is much, much more that we can do. So Chris, on my next slide, I just want to finish off by saying that not only is it that it's an underutilized skill set, when it comes to asking pharmacists to do the very best that they can for their communities, there has been no better example of the work that we do in the 4 corners of the globe than when we kept our doors open and enthusiastically looked after the patients who, quite frankly, were not being looked after by other primary care healthcare professionals. And at every opportunity, when given the skills, knowing the skills and given the opportunity to do so, pharmacists have taken up the challenge to look after their communities. And I really, really love this picture, which is of our colleague, Jennifer Curnew. And she is a COVID vaccinator, and she is a pharmacist, and she's in New Brunswick in Canada. I would love that in every jurisdiction and everywhere pharmacists work and serve their communities, that they would be able to do more, and that they would be able to get self-care as the core of what we do by giving patients choice and access to the fantastic skill set that we have based on the trust that we have grown with the communities that we serve into the future, which I think is a very exciting future. So, ladies and gentlemen, thank you very much, and I look forward to your questions.
Thank you so very much, Derek, for introducing us to the community pharmacy section, vision for community pharmacy between 2020 and 2025, and how community pharmacy can contribute both to a sustainable and efficient healthcare system, as well as an efficient self-care model, and always in development. I want to thank all speakers for their wonderful presentations and ask you all now to unmute yourself and start your videos, as we have many questions from our participants. And you can still submit questions in the Q&A toolbox at the bottom of your screen. So we have one question here from Faith Ogechi. The law in some developing countries does not allow yet pharmacists to dispense medications or even attend to mild ailments. How do we get this started, seeing all we do in the pharmacy promoting self-care? I send these questions to all of you. Please make a short answer. Judy?
I don't know. That's the short answer. I think it's more probably for Dara to comment on that as the pharmacist on the panel. But yeah, I mean, obviously, you know, there are different rules and regulations in every country. So I think that is a local issue, but I'm sure Dara probably has more insight into that.
Derek, would you like to comment upon this?
Yeah, I'm happy to take that one. One of the things that drives any profession forward, or we are also scientists, is to be able to look at best practice. So you will have seen already fantastic economic indicators that show the value of self-care. that's a given. So when we look around the world and we look at healthcare systems and how they work, there is an ambition towards universal healthcare, but ultimately it is something that will be a process rather than an event. So I was very lucky to talk with some colleagues in South Africa as they begin their journey towards universal healthcare there. I think one of the arguments that I would be able to propound is to say that we give choice and access through community pharmacies because it's what patients want, and it actually then gets best value from everybody who is working in a healthcare system at the level they work at. So when somebody says that we're not allowed to do that in our country, where FIP can be a huge help in those countries is that we have excellent templates that show the statistics, that show the science, that show every argument that says we should be able to do this. If I would give one really strong indicator as to how those conversations need to start, the conversation needs to start from the perspective of the patient. Because if we go to government and we go to lawmakers and say, we are pharmacists, we demand, we are then a lobby group of pharmacists. However, if we approach the governments and lawmakers from the perspective of the patient and say patients need to be able to, because the benefit is to the patient and the benefit is to the healthcare system in itself, it makes it easier to have that conversation because you don't get this idea of regulatory or lawmaker capture. So that would be my point that I would make is if we make the argument from the perspective of patient, person, community that we serve, and then show the benefit that we can be to them, that's a conversation that's easier to have rather than being a lobby group and that says, well, they would say that anyway.
Thank you, Derek. Catherine, would you like to comment or?
No, I think that was a good answer for Derek.
Thank you. Yeah, excellent. We have a question from Genna Donovan. What do you think are the barriers to community pharmacists, not necessarily pharmacists, taking a larger role in self-care in primary care? What is the perspective from the Global Self-Care Federation?
Okay, maybe I could start. What are the barriers? Well, I think for reasons that I'm not sure about, the pharmacist has always been, from I think our point of view and my point of view, a respected member of the community. But I think they haven't. We need a new spotlight on pharmacists, or we need to continue to shine the spotlight because they just haven't had the recognition, I would say, of the general community and the general public, and their skills have been underutilized. And I think, as I said earlier, that's one of the benefits of COVID, that it has shone a spotlight on the value of pharmacists as a trusted source of advice and a trusted healthcare professional, and it's shone a spotlight on self-care. So I think the barriers have been, for whatever reason, kind of lack of recognition. And I think how we can overcome that is having sessions like this today, and also working with groups like WHO and FIP and ourselves, working with other key stakeholders to really drive the role of the pharmacist in self-care.
Thank you, Judy. We have another question here, and it is raised by David Newby. How do we encourage evidence-based self-care practice by pharmacists? I look at the wall of dubious products in the average pharmacy here and worry how this gives undue credibility to these products. Do you have a comment, Derek?
Yeah, and I think that's a really, really good point to raise. There is a little trap that we can fall into that says that because we're pharmacists and we have an open door and we also do other things. So in my pharmacy, I sell perfume and I sell skincare and I sell things for babies' baths. Now, I'm not embarrassed by that, or I don't think I'm less of a clinician because I do that. What that does is that makes me relevant to the people and the population that I serve. So by a little bit of an extension of that, I always use the example of a copper bracelet. So I also sell copper bracelets because some people find them good for arthritis. So I've had arguments before with general practitioners who think pharmacists should be, I don't know, not doing lots of stuff. And the point I would make is that if you go to a private hospital and you then say to yourself, oh, I'm not going to have that procedure there because they do breast enhancement, all of a sudden it's the same argument, isn't it? Because you have to say to yourself, what is the clinical value of breast augmentation? That is a little bit of an obtuse thing to say, but the point is that it's about what pharmacists do should be only visioned through what pharmacists do. I don't ask permission of any other healthcare professional to practice pharmacy, nor do they ask me permission to do breast augmentation or to do colorectal screenings, which there may be no clinical need for, but just to make somebody feel better. So the point I would say is that yes, we must maintain a very high professional standard, and that is chosen by our regulators. It isn't chosen by other healthcare professionals. And certainly what it will mean into the future is that we as a profession must go to our regulators and demand very high standards, not to demand low standards.
Thank you, Derek. We have another question from Kasim Dangor, and it's directed towards the Global Self-Care Federation. Will the outcome of this research be escalated to governmental level in order to enhance the role of the pharmacist to address self-care of prevalent diseases and treatment, management, and of many more illnesses? The research you are doing within the Global Self-Care Federation.
So I'm happy to take this on. The simple answer is yes. As I mentioned, we'll be launching the report later in September, and the idea is that the findings are also used and launched at a global level to make sure that those recommendations are carried through and taken on board. So yes, absolutely.
And I guess we could add, Catherine, that we will marry the self-care readiness index and the outputs from that with our economic and social research that we'll have at the beginning of next year, the global study, to really use that in discussions on a local level with our members, with governments and policymakers, and obviously with internationally with WHO.
Thank you so very much. We have a question from Nora Gerpe, and I also think this is addressed to the Global Self-Care Federation. Sustainability and self-care, is there data on this point?
Catherine, do you want to take that one? Maybe I could clarify, I guess we can't clarify. We're talking about sustainability of health systems, and another priority initiative for us, just by the by, is environmental sustainability and healthcare and self-care, because that also contributes to sustainability of health systems. But in terms of sustainability of health systems, as we spoke about in all our presentations, I think there is not enough data, and that's why we're doing things like the Self-Care Readiness Index and the economic and social value, because we think we need more data to convince governments and policymakers that this self-care should be embedded in policy, and it should then trickle down to the community pharmacist, etc.
Thank you. Would you like to comment, Catherine, or?
No, just to echo what Judy says, in that this is exactly the reason that we've been doing the index and conducting the research, is to give these proof points. Yeah. Yes.
And a question linked to the previous one, and I will direct this one to Darag. It's a question from Jane Cloete. Why not allow pharmacy to give antibiotics over the counter, especially if someone have yellow or green slime being spotted out? Because why do we need to pay doctor's fee in order to get the prescription for an antibiotic?
Yeah, that's a great question. I saw it coming up, and you're absolutely right. So if we go back to the 4 pillars of what we're talking about doing, we're saying that, right, so you consider the instance where a patient presents to you with green slime. So we then And this is the evidence base, is to say this is why we do it, and this is why it is a professional thing to do. So we review the patient, we prescribe, we dispense, and we administer. So right now, I am aware of a pilot that is now turned into a service by community pharmacists in Wales, in that corner of the United Kingdom, where if you have a sore throat and you think that you have a bacterial infection in your throat, you go to the pharmacy and your throat will be swabbed. The swab will then be reviewed. And if it's a case that you have a bacterial infection rather than a viral infection in your throat, you will receive from that pharmacist a prescription for antibiotics, and you will not see a primary care physician, and you will not go to the emergency room in secondary care. Exactly the same as that, and I quoted our colleague there from New Brunswick who is vaccinating already. So in New Brunswick in Canada, if you are male and female and you think that you are suffering from a urinary tract infection, you can present at your community pharmacy and you will again be reviewed, you will be prescribed, you will be dispensed and not administered, because there isn't an administration with it, for antibiotics for the urinary tract infection. So if that is a system which doesn't exist in the country that you're asking the question from, the opportunity exists for you, and this is all of this information is available through FIP, who said to promote self-care, to be able to say that these simple infections can be dealt with by community pharmacists in their pharmacies. This is international best practice. This is the economic background, and this is the clinical background to which it happens. So the good news is that this is happening already. And as a very good colleague of mine once said, the future is here, it just isn't evenly distributed.
Exactly, that's the way it is. Thank you, Derek. We have a question from Abdullah Shehu. How can FIP collaborate with the Pharmacy Council and Pharmaceutical Society to enhance the awareness of self-care in the pharmacy outlet and community pharmacy? One part is the entire program, but this is also something we, of course, will discuss within FIP and our regional forums, how we can support the pharmacy councils as well as our member organizations in developing and supporting self-care in the different countries. So actually I did answer that one myself. And we have another question here, it's from Muhammad Suleiman. Pharmacist-related self-care cannot be without drugs. Have the team categorized the group of drugs or diseases where self-care can apply? Perhaps Judy can answer to that question?
Yeah, sure. So with the Global Self-Care Federation and our members, we are all about non-prescription medications in a general sense. Probably we will be about nutritives and devices as well in the future. So we are about non-prescription OTCs and how they can help on the self-care journey. So what was the first part of it about non-prescription? The first part of that question, Lars?
Well, it was I have it here again, that pharmacist-related self-care cannot be without drugs or medicines, and have the team categorized a group of medicines, drugs, or diseases where self-care can apply.
Sure. Well, I mean, I really think with a lot of pharmacies, it is about OTCs and not prescription medicine, so that makes it easier. And I would say that that's pretty common. I mean, Dara, maybe you want to comment. Around the world. Where it gets tricky is if it's a prescription medication, but we can see obviously changes with prescribing in terms of, say, antibiotics and other things that have been prescription traditionally and for UTIs, etc. So generally we see self-care and OTCs and non-prescription medications so that pharmacists can easily, prescribe those if you like. But Darren, maybe you want to jump in.
I back that up. So really, if you consider the regulatory systems that we work in are, pretty much the same around the world. Some are very conservative, overly conservative, in my opinion, as to the armory of medicines that pharmacists have to be able to offer the communities that they serve. So it's not really that even that it's an armory of medicines, it's the solutions that pharmacists can provide in order to help people achieve self-care. Again, I go back to say to colleagues from around the world who maybe feel frustrated that they aren't being allowed to offer a full suite of services to the populations, the people that they serve, is that the empirical evidence is out there from around the world about the safety of those medicines and about the appropriateness of pharmacists prescribing them. A very curious one always comes to the fore about antibiotics and pharmacists prescribing and dispensing antibiotics, and about the stewardship of antibiotics and antimicrobial resistance. I don't see our colleagues who actually have the authority to prescribe antibiotics covering themselves in glory around the world anyway. We have a very unique situation here in Ireland, that because the general practitioners themselves stopped seeing patients and only saw them virtually or over the phone, overnight we saw an absolute fall off the cliff of antibiotics being prescribed for children. So I have a unique scenario in my pharmacy where I have had to dump powder antibiotic because it's gone out of date, because GPs are no longer prescribing antibiotics for children. And I am going to hazard a guess and say that no child has died. And I'm also going to hazard a guess that no child has ended up in accident in emergency with septicemia because they didn't get their antibiotic. I don't think that we should ever fall into a trap to say that we are second-class healthcare professionals who can't be trusted with the stewardship of medicines. I think the contrary.
Thank you so very much, Derek. We have another question from Adrian Shepard. It's a question for Catherine. Has there been any friction in the drive to self-care from the community of doctors, or do they embrace the concept?
So as I mentioned when I was talking about the research, we made sure that when we were doing it, we involved as many different organizations, including various healthcare professionals, as part of the research to make sure that they were involved in the process and that we're reflecting their points of view. So far, we didn't see friction. We definitely saw support towards that. So yeah, I think it's been positive so far.
Oh, that's excellent, excellent. I have a question for both Catherine and Judy. Do you have a view of in how many countries is self-care an integral part of a nation's health strategy? And from that question, I would like to raise another question to Derek. And how can we make community pharmacy a key actor in the national health strategy and self-care with a clear role and objectives? But first, the question to Catherine and Judith, are you aware of in how many countries is self-care a part of a national health strategy?
Well, I guess I could start and say that's a very short answer. Not many. Not many countries. We know, for example, in England, they have a self-care policy. I think Australia as well has a self-care policy. Canada is working towards it. So various governments and the health departments of various governments have released self-care policies. But I wouldn't say that it's really kind of embedded and a key part of many national health strategies at all around the world. And so that's just the sad fact, if you like. But I think we're seeing a lot of changes, and with a lot of things that, a lot of research we're doing, working with WHO, a lot of the work that FIP are doing, we're seeing that change. And I think in the next 3 to 5 years, we'll see big changes in that. But we need to work together as key partners to really drive that, I think.
Yes, I think it's really important. I have a friend, he is auditor, and he always says, if it's not written, it doesn't exist. It's just a desire. Although we know that self-care exists, because it does exist, and we do a lot every day. We have to be proud of what we do, but we want to do a lot more, and we can do a lot more, both for our health systems and for our societies as well, and the patients, of course. But Derek, what would you like to say? How do you think that community pharmacy can become a key actor in the national health strategy when it comes to self-care?
the greatest advocates for community pharmacy are the communities that we serve. And the second greatest advocates for community pharmacists, and the ones who are probably quietest, are community pharmacists. So I think that we spend far too much time downplaying our role, being somehow quasi-subservient to the people who go around with stethoscopes, and asking nearly permission of other healthcare professionals to do the best that we can for other people. So I would like to see a step change in that. I would like to see community pharmacists around the world going out and getting more partnerships with interested parties who represent different patient groups, or again, as exampled by this conference that we're having today, in lining up with people who are aligned to our vision of what community pharmacy can be, and accentuating the best of what we are already. And that is perfectly exampled today in the collaboration here with people who care passionately about self-care. I think that pharmacists also probably need to pay a little bit more attention to, and again, it came up in one of the questions, about the evidence of the value of what it is that we do. And there is no shortage of evidence, because you saw it was really, really well put together in both Catherine and Judy's slides as to the empirical evidence of the value that this brings. When we make that as the foundation of who we are and how we want to go forward, there is no other way to go forward. But if it's a case that pharmacists out there think that people who aren't pharmacists and are involved in healthcare are going to advocate for a greater role for community pharmacists, it's not going to happen. It's up to us as community pharmacists to do that and to push that agenda ourselves.
Thank you. Another question to all three of you. Judy mentioned the future of self-care and digitalization and new channels where patients can seek support, advice, and even buy products. How can we make sure that they use a reliable source online? Judy, would you like to start?
Not really. Yeah. Well, that is a big challenge, and it does tie into self-care health literacy as well, and how we can make sure that consumers and individuals become more health literate from good sources, from reliable sources. And I think this is a continuing challenge. And again, we saw it with the infodemic during COVID. You know, with
yes.
You know, and on YouTube and Facebook and things like that. You know, reliable stuff and you know, information that was just absolutely absurd. So I think that how can we make sure? I think regulation and better policies as well around the evidence and around the information that's put on there through health data, through digitalization. So I think that needs to happen, and that really is a country level issue and job, if you like, that we need to have proper regulation, but combating the infodemic and wrong or ridiculous or downright dangerous information is a continuing problem. And whether it's the pharmacist, the doctor, the nurse, or just generally, it is a really difficult issue. And I'm sure others have something to say there, but I don't have the answer, but we have to keep working on that, because this telemedicine, the infodemic, information available online, as we know, it just continues and continues. New apps every day, some of them are fabulous, some of them not so. So we need to keep on top of this, but it is a major job. And again, it's another example of where we need to join together as organizations and see, okay, what should we be doing and what is our stance? And we are working, we have a key initiative around health data, self-care health data, self-care data, and looking at what our guiding principles should be for our own members and organizations involved with us.
Thank you. Catherine, do you have a comment?
Just to say, obviously, to Judy's point, that this is also a local issue with the different countries to help people navigate. But I think from a global perspective, there's also efforts that we can do to make sure that the information we're publishing, you know, is credible and scientifically backed. I think that it's both a global and a local responsibility.
Thank you. Derek?
Yeah, I'd agree with my colleagues in that, absolutely. And I think some countries are better prepared than others. So even though we are here in the Republic of Ireland, I would often direct people towards British and NHS online portals in order to, just get a little bit of background information about it. But I suppose if those things are, that I can access from the Republic of Ireland into the UK, anybody from around the world can. It's very, very complicated, but I would go back to that really, really big word that we used in the vision, is that trust. People trust their pharmacists. The most recent survey done by an independent body in Ireland came out with a 98% trust rating for community pharmacists.
Yes.
It was just 1 point below nurses and 1 point above general practitioners. And unfortunately, the people that we have to go to make change happen scored about 22% trustworthiness, and those were the lawmakers and the journalists. But
yes.
No.
Thank you so very much, all of you. Chris, I think we need to continue with the slide deck and wrap up this event as time is passing by. So in order to conclude this, I think that we can say that self-care interventions are evidence-based quality tools that support self-care. And they include medicines, counseling, diagnostics, and or digital technologies which can be accessed fully or partially outside of formal health services. And of course, depending on the intervention, they can be used with or without the direct supervision of health workers or community pharmacies. From a public perspective, I think that self-care plays an important role, both for individuals and for our health systems. And for individuals, the capacity and ability to make informed decisions and make use of available health resources is an important contributor to the successful management of a health condition. And also for the health system too, there are of course many advantages to promoting self-care interventions while still remaining perhaps responsible and not putting additional burden on individuals. And health systems can thus optimize self-care as one of the most innovative approaches to improving health coverage for all. So it is definitely a core component in today's and tomorrow's healthcare model and becoming more and more important. And it is being developed actually every day. So I would like to advise all of you who are attending the session today to follow this very important program regarding self-care and how to develop the pharmacy teams of the future as well. So I therefore encourage you to register for our next events in shaping the future of self-care through pharmacy. And the next one is actually appropriate management in the choice of medicines for self-care on the 2nd of June. I would also, we can take the next slide, Chris. Advise you to follow and check all our future FIP digital events at events.fip.org. There you have the whole program and can register for all the sessions at the same time. By this, I would like to thank our excellent speakers for participating in this session today, for your excellent and wonderful presentations, for your wise input, and for sharing your views and your experiences. Self-care is becoming more and more important for an efficient and sustainable healthcare system, where also self-care literacy is key. So thank you all of you, and thank you all of you who have attended this session today. It has been great to have you all with us today. So by this, I would like to thank you all and wish you a nice afternoon or a good night's sleep, depending on where you are. Thank you all so very, very much. Goodbye.
Thank you, everyone.
Bye. Thank you.